go, guys. Episode 3. Welcome back. I'm really excited for this episode because this episode's all about us moms. As y'all know, becoming a mom is such a whirlwind. Journeys look so different. We don't all have the same journey. It starts from whatever it may look like of trying to get pregnant to conception, first, second, third trimester, postpartum, and then, I skipped labor and delivery, postpartum, and then, after the baby's born, everyone's growing and just, adjusting to life as a mom, whether it be your first time mom or second, third, and go on. So I'm really excited that this episode's all gonna be geared to our moms. So if you're a mom, join in, bring in dad, bring in a support system. This is gonna be a great episode. I'm really excited that we have our expert here today. She is our OB Associate Medical Director for Driscoll Health Plan. She's also an OBGYN at a local hospital, and she's also a business owner of her own med spa. So Dr. Roxanna Doucet, welcome.
Thank you. I'm super happy to be here with you.
I'm real excited that you're here today. Like I said earlier, I heard you speak at one of our community events for Healthy Mom, Healthy Baby.
Yes.
And you are so passionate about what you speak, the messages that you relay, and just everything about women and maternal health. I'm so happy that you're here today and that our viewers get to get insight of that too.
Yeah, I'm super passionate about women's health. I always had a calling towards it. Mm-hmm. So I'm happy to share any information that I have with all of our members and our watchers out there.
Perfect. So let's break it down. So
Okay.
OB Associate Medical Director
Yes.
for Driscoll Health Plan.
Yes.
Just give me an insight of what that looks like and what you do for our members and our communities.
Yeah, I think that people don't realize how many initiatives Driscoll Health Plan has going. Mm-hmm. So our goal right now is all about getting healthy babies, healthy mommies, safe deliveries, excellent health care. Mm-hmm. And so part of my role is rolling out initiatives that we have in place to increase prenatal visits, postpartum care, looking out for all the complications associated with pregnancy like diabetes, hypertension, helping our members receive resources that they need like, transportation to their visits or maybe food resources, housing, whatever it may be, because our goal is to optimize all of her prenatal care so that she can have an excellent outcome. And so all these mommies and families can have healthy families and babies. So that's our goal. And I oversee many initiatives, and we have so many things going on right now, which is exciting.
That is exciting.
Yeah.
And that's awesome that we have, a true expert in the field of coming up with initiatives for moms. So it's not just someone who has an idea about it. Like
Right.
You are in there, you know exactly all those questions that are asked, all those problems that you
Right.
see, and then how we can prevent those.
Right.
And so for, like you said, healthy moms, healthy babies.
Yeah. Well, I will say here at Driscoll Health Plan, there are so many women and men that are very passionate about this idea as well. So there's a team. It's not just me alone.
Okay.
I bring the OBGYN expertise to help guide the questions in the programs, but really there's a whole team of compassionate people that are behind the force making these things happen for the people out in Corpus Christi and in South Texas in general.
That's amazing. So what, if you just name just a few, what are some initiatives going on right now?
Yeah, that's great. So right now we have a program going on that we're the first health plan in our area to start what we call the maternal health homes.
Okay.
You can call them maternal health and wellness homes, but we have a pilot study going with a group in Victoria where we have a nurse liaison who talks to the nurses of those doctors out in that community. And so we're getting referrals for women who have diabetes or hypertension, getting them plugged in, making sure they're keeping their appointments, anything that I already mentioned, like transportation needs so they can get to their appointments, helping them find places for childcare so that they can get to their appointments. So this is one initiative that we have. It's in its infancy. We've completed 1 year, and we're learning a lot about it. But our role initially was increasing prenatal postpartum visits, helping them talk about family planning issues and contraception for birth spacing. And we're also have an initiative working on C-sections. So we really have a passion about decreasing C-section rate, especially with primary C-section, which basically means mommy's pregnant for the first time.
Yeah.
We want natural childbirth. In some circumstances, That's not always possible, and we have
Yeah.
to perform C-sections. But helping providers give these women the best chance that they can for natural childbirth, vaginal childbirth. So these are some of the things. We have a nurture program going on about food and teaching women about healthy food choices
Oh, that's a big one,
in their
yeah.
pregnancy. We have many things, but that's just 2 samples
Yeah.
of many initiatives that we have going on.
That's so awesome to
Yeah.
hear, because not only are y'all going, like, how do you say, like, not only are y'all directing towards like the member, but y'all are going the other way as well to the providers,
Yes.
and making sure there's a whole circle
Yep.
of with the same message, and everyone's basically on the same page when
Right.
it comes to that time.
Well, I think Driscoll Health Plan in general and the world does a great job teaching and arming our patients with educational material to help them understand what's happening in their pregnancies and with their health care. But on our end, like, I can talk directly to my colleagues and say, hey, there's this new initiative going on. We want you to be involved. What do you think, or what are your ideas? So we have like a branch. It's not just members alone, but it's
Yeah.
providers and members. And we have goals and programs heading in both directions. So that makes us unique.
Everything that you're doing, you and your team are doing with Driscoll Health Plan, and for our members and everything is extraordinary. And I can't wait to see that really into play when it
Yeah.
comes to it. So what inspired you to be an OBGYN?
Yeah. So my background, actually, my bachelor's degree is in nursing.
Oh.
Yeah. And so I'm from Corpus Christi area, and I nursed at the old Memorial Hospital.
Oh, wow.
So all my career and all my training, I was like, oh, I'm going to be pulmonary critical care. You know, this is it. But
Yeah.
when I delivered my first baby as a medical student,
That was it.
It was a sealed deal. I was like, oh my gosh, this is amazing. The miracle of birth.
Yeah.
And helping these women. It was just, I knew I was hooked. It was passion in my heart. And then as I did my residency training, I really enjoyed performing surgery. And so surgery became a huge passion.
Wow.
Like all the GYN, the gynecologic
Yeah.
interventions that we do. But I still loved the birthing process
Yeah.
too. So for me, marrying the surgical aspect as well as clinical aspect. We do a lot of procedures in the office, things like that. So it was just a perfect blend for me. And I just love taking care of women. Like, you know, I'm a woman. I understand the issues that we all
Yeah.
go through when we're like pre-marriage, and then
Yeah.
we marry and we have our children and we have our babies, and then, you know, change of life issues. So it's like a full gamut. And I get it because
Yeah.
I've been there, done that.
Yeah.
And so, but I really just loved the birth process. It was just, you know, seeing these women glow after having a baby, it was just like, I was totally hooked. So there was no doubt what I was going to do.
Yeah.
Yeah.
I love that.
Yeah.
Oh my God. Your patients are so lucky to have you,
Yeah,
because
thank you.
I can
Thank
just
you.
tell already that you're so caring, and it's so motherly
Yeah.
coming from you. And
Yeah.
so I just know that they feel like at ease whenever
Yeah.
it's that time.
Thank you. Yeah.
Are there any stories that like stick to you?
Well, you know, I think back at my career. So I've been doing the work for 23, 24 years now. And so there are so many stories. And it's hard to say. Like, the things that I think about are the scary things, you know, like the times where maybe I was very incorporated into saving a life. Those are the things that I think about.
Okay.
Because I think, oh, thank goodness I was there. Thank goodness I had a strong team that I was working with. But I look back at my private practice life, and I think about like, and I still have visions in my mind of patients of mine who I saw them before they were married, and then, you know, getting invited to the wedding, and then, you know, delivering their babies. I mean, it's just a full gamut. And for me, it was such a gift to be part of those experiences that I can't say like I have one delivery that was amazing.
Yeah.
And even from a GYN standpoint, like discovering cancer, you know, breast cancers in a patient, and walking with that patient through that journey, and getting that 5-year, okay, you're cancer free, and now 10-year, you're cancer free. Those are like little gifts of like, okay, I know I'm doing the right thing because I'm helping women have healthy lives. So, you know, when you had asked me that question, you know, getting prepared for being with you today, I was like, gosh, I can't really say that I have the one.
Yeah.
You know, I have the one scary experiences, and I don't want to talk about that.
Yeah.
They were all good outcomes. But in terms of the joys of my career, there's just so many. And even today, like, I function as an OBGYN hospitalist now. I don't have private practice. But even when I'm with those women and delivering those babies for them, and I'm with them for a brief period of time, 24 hours or even less, it's still a joy to me. And I get to hang around afterwards, and I get to hold their babies, and then I get to hand them right back.
Yeah.
So, I can't say for sure I have a distinct positive. There's many.
Yeah, that's amazing because, you know, we as doctors, I bet y'all see a lot, especially and as surgeons as well. So the fact that one, like you have so many great success stories, like it's hard to narrow down one, but two, that like you don't let those scary stories get to you. You know, you have, it seems like you have one goal in life, or like you have multiple goals, I'm sure.
Yeah, I do.
But like with your practicing, like you have one goal, and just make sure mom is healthy, that baby is healthy, and that just keeps you going, and it's just all positive. So that's really amazing to hear. So switching gears here, you mentioned your private practice, and then I know you are a business owner of your med spa. Can you explain that a little bit more?
Yeah. So my medical aesthetics practice kind of happened to me. There is a little story. I'll keep it brief.
Okay.
But when I was in private practice, I was walking by a hallway, and I saw this old dinosaur laser machine. But at the time I would treat, and a lot of the members may kind of relate to this, there's a condition called polycystic ovary syndrome. We now call it metabolic syndrome.
Okay.
But these patients suffer from hirsutism, or hair growth in areas we don't want it. I was treating them medically with the medicines and things that we do to help them with their condition. But the laser helps with the hair growth. So I'm like, you know what? I'm going to learn how to use lasers. Now, this was 2-3 years into my career out of residency.
Oh, okay.
And I went and I got myself trained, and I got certified in lasers. And so I started doing laser hair reduction with this old laser that, like, I don't even know if it exists anymore. So that's kind of how it started. And then segue forward several years, a partner of mine was like, have you ever thought about doing Botox and fillers? And I'm like, no. And then I had a patient like, Dr. Doucet, you know, you did my C-section. Why aren't you doing my Botox? I'm like, well, I don't know. I do laser hair, and I guess I can. So it kind of happened to me.
Nice.
But what I realized is it's also very joyful.
Yeah.
Like helping women feel good about how they look. We also have men. So it's not just a full women's practice.
Yeah.
We have husbands and wives come in, or women come in with their boyfriend, and we treat them as well. But we're multifaceted. So we do skin conditions, we do rosacea, acne treatments, and body contour, and weight loss. And we're a full service medical aesthetics practice. But it kind of happened to me through my medical practice. And so like now everybody's, you know, throwing up a shingle and doing neurotoxins and stuff. But like, I think it was a plan.
Yeah. Talk about meant to be.
Yeah, it was meant to be. And so helping people be healthier, having optimizing their general health and wellness, and giving them better quality of life. But a lot of people come for cosmetic reasons, and it helps them feel better about their appearance, giving them more confidence.
Yeah, definitely.
Especially, it's really quite unique. I think about how we've all went through the pandemic and how everybody was locked in. But that particular time, even though it was very trying for many people, it was very eye-opening to a lot, because we went into the Zoom mode and the WebEx mode, and oh my gosh, Dr. Doucet, I look at myself in the computer and I like need to do something. So, you know, my aesthetics practice has really flourished. Even out of the pandemic, something so negative turned into such a positive for many people. So that's sort of my business and it's like my kind of quasi side hustle, but it's really not. You know, I'm busy. I'm almost there every day of my of the weekday.
I can imagine.
So, it's fun. It's really fun.
You're active in your business. You're an OBGYN at a local hospital. You're here, associate medical director. You are a true powerhouse woman.
It's crazy
in the medical field.
Sometimes I think I'm doing too much. Like,
oh man,
but it's fun. If I could touch people's lives in many ways, and make them have healthier lives, I'm happy. That's what brings me joy. What else would I be doing? You know, just sitting around at home? No way. That's not in my gene pool.
That's amazing. That's so like comforting to hear that there's like doctors like you out there. And, you know, as a patient, that's all like we're trying to look for is the doctors who connect and who just want literally just the better. Because there's always like that misconception of like, oh, doctors do this just for the money, and, you know, they push this for the money. And just speaking with you here today that it's just full driven on passion.
Yeah, for sure.
And I really appreciate that. I know our viewers will really appreciate that.
Yeah.
So like speaking of like misconceptions,
Yeah.
maternal health and women's health, it's so broad, and we can go in depth with everything. And that's why more episodes will come with Dr. Doucet.
Yes, I'm excited about that.
What are some common misconceptions that you see or you hear from patients throughout your...
Yeah, I think the biggest thing, so maybe I need to clarify what I do now.
Okay.
So as a hospitalist doing my specialty, we have doctors board certified in our local hospitals 24/7 who are delivering care to women who come in for any problem. So whether they be with no prenatal care, or maybe they're visiting from out of town and they don't have a doctor, but they're having a complication, or maybe their private doctor is unavailable at the moment and we're Johnny on the spot ready to help them. So that's the beauty of our area here in Corpus Christi, that we have doctors available at both our delivering hospitals. And I think that's very important for our members to know, that there's always somebody there that has your back, you know, here in town. But that role has opened my eyes to other things, because I was very blessed in private practice that I had awesome patients and my partners were really great, and we had a very good, healthy practice, but we didn't really care too often for women who had no prenatal care. And so now as a hospitalist, there's a whole area that I'm able to touch those women's lives and give them the best care that I can. The misperception and the misconception, I guess I should say, is that there's a movement of women that don't feel like they really need to see the doctor. And so we're seeing women like, honey, you have access to physicians in our community. Well, I didn't have any problems last time and everything went okay. And that's really eye-opening and alarming, because that's a misconception that because everything went well the first time, they're going to have everything fine this time. And unfortunately, sometimes we find that maybe the babies don't haven't developed properly, or maybe they're having blood pressure problems, or maybe they're diabetic and they haven't been treated, and now the baby's going to go to the ICU because the sugars are not healthy. So my biggest ploy is don't think that just because everything went well the first, second, third time that you don't need prenatal care. There are doctors all over Texas who are willing to help our patients out there and to deliver care, because the key is seeing that problem before it turns into a disaster, right? So it's all about prevention and looking for early warning signs and making an intervention before it turns into a catastrophe. So if there's any plug I can make out there is please get prenatal care, even if it's a visit or two. Get an ultrasound, get some lab work done. Don't think that not getting prenatal care is okay. It's not. And there are experts everywhere that can help our members and our people out there.
Especially at no cost. I know like at the Healthy Mom, Healthy Baby, they had screenings or like free pregnancy tests and free ultrasound, and especially if you didn't have a doctor already.
That's right.
So if there's all this free information out there and then no cost services. Right. It just takes a simple of looking, whether it's on our website or the city's website of where you're located at, and see what health fairs are available and they're coming to you.
But not only that, like I don't know if you realize, well, I'm sure you know, but there was a table there helping women sign up for getting on Texas Medicaid so that they can start seeing a provider.
There you go.
There are access points of getting women help. And it can be daunting, filling out the paperwork and going on the computer. But everywhere you go, you're always a phone call away of having somebody help you through that process, because it can be very scary. And like, oh my gosh, they never called me back or whatever. There are resources available all the time to help our women get plugged in to any sort of Medicaid program to help them through their pregnancy.
Agreed. And once that Medicaid application, like you said, it can be daunting, filling out everything that you may need. But once that application is approved, like it's smooth sailing from there.
Doors are open.
Exactly.
And people are willing to say yes. You just have to pick up the phone and make that appointment or whatever you need to do.
Agreed. So like you said earlier, how that misconception of like everything was fine the first time, and it may not be so the second time. So, like I mentioned earlier, I just found out I'm
Yay,
pregnant.
I'm so excited. Congratulations.
Thank you so much.
Yeah, that's awesome.
So I am about 13 weeks right now.
Yeah, wonderful.
And you're right. You know, it's what I just felt in these past like 4 weeks. I didn't feel my first pregnancy.
Yeah.
And it was such like a, oh my goodness, like I can only imagine what the rest of these months are going to look like.
They're going to be great. You'll be fine.
Yes. Thank you. But yeah, so it's just so important just to keep on top of that and to, you know, be aware of like your body. Like you said, like we know our bodies best.
Right.
And so for women, it's just important that we just stay on top of that prenatal care with like prenatal vitamins also as well. And everything that involves with that.
Yeah.
So I know one thing, stepping out of like prenatal, one thing that it's not usually talked about, and it's kind of a topic whether like moms may feel ashamed that they went through or that they may be going through right now, but like postpartum.
Yes.
Overall, postpartum recovery, postpartum depression.
Yes.
It's a sensitive topic.
Yes.
Because there's so much that we don't know as someone from who's not an expert in your field. There's so much that we don't know, and it looks down upon, or like, well, I don't know why you're sad. You have like this village helping you,
Right?
It actually, and I just from what I just found out with this pregnancy, it can happen during pregnancy.
Oh, for sure. Yeah.
And I didn't know that, and now everything's starting to make sense. But now, because of something I already went through, I'm more aware of what I need to do to
be proactive.
Exactly. So let's talk about that postpartum depression. You know, how is that from an expert? How is that diagnosed, or like what are the signs that you look for whenever moms come in for that 6 weeks after delivery?
Right. That's a great question. Well, fortunately now the state of Texas is being very proactive about behavioral health screening. And we as a health plan are formulating initiatives to help that process. Okay. So during pregnancy, there should be at least at a minimum one screen.
Okay.
At delivery, at the hospitals local, there are several screenings, whether that be, there's something called an Edinburgh Depression Scoring, the PHQ testing. There's all these fancy tests that are available, and that happens at intake to the hospital as well as upon discharge. So that's 3.
Wow.
And then there should be at least 1 to 2 screenings after delivery. So in the circumstances you were alluding to at the beginning of our visit that, you know, every pregnancy is different. And based on previous experiences, those testings may increase depending on what goes on. But they're simple questions. It's a simple questionnaire. And that helps guide the provider, whether that be the physician or the nurse practitioner or even the nurses taking the intake, that there might be a little warning sign. We need to watch this patient, you know, closer.
Yeah.
So that's number 1. So there are initiatives in place to help screen for these problems during pregnancy, at delivery, and postpartum. So be aware that that's standard.
That's comforting to know.
On top of that, from a patient standpoint, you know, you alluded that maybe you had a problem before and maybe you're looking for those issues now, perhaps.
Yeah.
But in general, we as providers or family members or loved ones of or the patient herself can be thinking of like, I just don't want to get out of bed. I don't want to do any self-care. I don't want to take a shower. I don't want to take care of my other children. You know, things of feeling like hopeless and helpless, feeling sad, feeling overwhelmed, feeling tired all the time. You know, these are issues that, you know, crying, having a lot of anxiety, even though you have a village around to help, you still have these instincts that something's not right.
Yeah.
And those are the times that women need to reach out for help because there are resources, telling their provider, whoever's giving them prenatal care or postpartum care, that, you know, I realize that I just don't want to get up out of bed in the morning. I'm feeling overwhelmed when my baby cries, and asking for help because there are resources available. and getting that woman the care that she needs, the support she needs to get through that time. I think you're right. Like, all women go through what I call the postpartum blues. There are physiologic reasons, hormonal shifting, that can cause women to feel more sad, more weepy, more crying. But sometimes it's in excess. And how do you know the difference? Well, the best thing to do is ask. You know, I feel like I'm just crying all the time. What is wrong with me? And that way, that provider can maybe use those screening tools to help figure out, is there really an issue here, or is this just the blues? You know? Because all women go through that. Even sometimes the partners will go through a little bit of a change, because it is an adjustment in life, having a newborn in the home. But asking for help is my biggest ploy. Like, just ask, because there's resources to help. And don't feel afraid. Don't feel like you are less of a woman, that you're feeling this way. Like, nobody feels this way. I'm alone in this. It is not. It's more universal than people realize.
I'm glad you're here expressing how normal it is for women to be feeling like this, how, you know, there's like those postpartum blues and then like the postpartum depression. One thing I had to get over was, or not get over, just realize that, you know, this is a common feeling.
Yes.
You know, I'm not the only mom who's experienced this, and I just need to rewind. It's a common, I can't think of the word. I'm going
like a feeling, or like a symptom.
So it's a common symptom, and it's a common feeling when it comes to after delivery.
Yes.
Like you said, just readjusting to a life. I know after I had my girl, there was those hours afterwards, because I had a C-section, and we'll go about that later. It was all like a blur, really, because I still feel medicated, and they're here like teaching me how to do this, teaching me how to do that. And I'm barely hanging on. And then just like those nights of just getting used to those cycles of like every 2 to 3 hours feeding. And everything like that. So it is common, you know, for moms to feel overwhelmed, and for that feeling to kind of stay. But I'm glad that, like I said, I'm glad that you're here to relay of this. Just ask for help.
Yes.
And y'all are here to help. Y'all have the tools that we need to get through those steps.
Right.
One thing I didn't know about pregnancy was postpartum preeclampsia. I've heard of preeclampsia, of course, like during pregnancy, but postpartum, like I didn't know about that. Can you explain more of what that is?
Yeah, it's more common than people realize. And, you know, the warning signs people don't realize, because they, especially postpartum. So simple things like a headache that doesn't go with drinking water and taking a Tylenol or whatever pain medicine people take, or being swollen that doesn't go away, or having chest pain, shortness of breath, palpitations. Sometimes people are feeling these symptoms, and they think, well, you know, I'm sleep deprived, I'm exhausted, I'm overwhelmed, you know, just and they ignore those symptoms, and that's when some very scary things can happen.
Man, you mentioned the feet swelling, so like, how about like what's the length of time that they should be going down, and what's too long?
Right. And that's unique to each person. So, but on average, you know, if you think about the physiology of pregnancy, there's so much circulation going to the womb to feed our babies as they grow, that after birth, whether it be a vaginal delivery or a C-section, there's a huge dump of fluid into our blood vascular volume, right? So people are like, oh my gosh, you know, rounding postpartum on these patients are like, I'm more swollen today than I was yesterday. What's going on? And that's the body accommodating for the fluid shifts. And the body has to put that fluid somewhere until the kidneys can pee it off. And so swelling postpartum is very common, and it could be more substantial than pre-delivery. But that, and women who have healthy kidneys and healthy hearts and not having other medical complications, within a week or so, that should be gone. So if you notice like your swelling is getting worse, you're feeling short of breath, and why aren't my ankles going down, and I delivered 3 or 4 days ago, what's going on here? And the swelling related to preeclampsia or gestational hypertension, it's different. It's not just feet swelling. It can be hand, it can be face.
Oh, wow.
And you hear me say shortness of breath, like that fluid can go to our lungs. And so we feel short of breath because the fluid's in our lungs, not necessarily showing on the outside.
And that's just like doing anything, that shortness of breath, right?
Right. So in pregnancy, it's normal to feel short of breath because the baby is growing and pushing up on our lungs. And then we have our intestines and our tummies get full when we eat.
Yeah.
So feeling shortness of breath in pregnancy is common and normal.
Okay.
But if it's in excess, where you really can't catch your breath to say a sentence, or you're like, I just cannot catch my breath.
Yeah.
That's the time to call for help. Call your doctor, call your provider, go to a local emergency room just to make sure that it's not something more. I don't want the ERs to be full of women with shortness of breath because it is very common. But if it doesn't go away after a couple days, there may be something more. And the big keys are headaches that are unrelieved with normal maneuvers like hydration, rest, and like a Tylenol. Having abdominal pain that's not going away, like a C-section, you know, it's normal to take your pain medicine. You're going to be sore. You know, as your body heals, that pain should be improving.
Yeah.
But if you have pain that's constant, that doesn't go away, that can be a sign of a problem such as postpartum preeclampsia.
Okay.
And then I'm going to kind of segue into other things that women need to look at is, you know, bleeding excessively. Like after delivery, whether it be a C-section or vaginal delivery, over time, the bleeding should decrease. But if it's not, and it's substantial, and you're feeling a little lightheaded and you're having a headache and shortness of breath, maybe the bleeding is more than it should be, and you should get it checked out. Call your provider, come to the emergency room. Fevers, you know, fevers that don't go away with Tylenol, you should never have a fever after delivery. There are conditions where women get infections when they're in labor related to maybe having their membranes ruptured longer than normal, things like that. So fevers during labor and even postpartum for a short period of time, but that should all be treated at the delivery time. If you're running fever outside of the hospital after your discharge, that should be, and get a thermometer, just check your temperature. And if it's greater than a certain point, I guess I could say it's 100.4. 100.4 or more persistently is a warning sign. You need to call for help. So bleeding, headache, pain that doesn't go away, fevers, shortness of breath, chest discomfort, swelling that doesn't go away over a period of time. These are all the warning signs. And people can go, like on our Driscoll website, we have the Hear Her campaign link, but you can type into your phone just Hear Her, and that is the CDC's new initiative to teach women about warning signs pre-pregnancy, postpartum, and also in the Hear Her campaign website, there are little video vignettes that people can listen to about different, like you share, you're showing your vulnerability, sharing your story about maybe some postpartum or intrapartum blues or sadness or depression. On these little vignettes, there are warning signs for preeclampsia, warning signs for depression, warning signs for anxiety, fevers, and they're real women sharing their stories so that our people and our members can know they're not alone in these scenarios, and that's a good resource for people to go to.
It really is. You know, when I was doing my research on Hear Her campaign, it was these Olympic athletes giving their stories, and it's like, wow, you know, they're in the greatest shape, you know, better than most of us because they're an Olympic athlete,
right?
And they're experiencing just what I am, you know, whether it's with postpartum depression or those urgent warning signs after delivery. So, yeah, you know, it's really important for moms, but also for their support systems to know all those signs that you just said, because as moms, as we all know, that we're just like we're on a, not hyper mode, but like we're going
baby focused.
We're baby focused, and you know, we're just focused on baby. We don't think about ourselves unless like we really feel it, and that's usually the time when it might be, you know, like a little
more
too
dangerous,
late. Yeah, more dangerous. So it's important that our support systems know of these signs,
right? And
to just, you know, if anything, keep a list. Post delivery, like keep a list, like these are the signs, and like put them on your fridge. If she experiences anything like this, you know, that's when we need to call the doctor.
Yeah, and I think I'm going to kind of piggyback on that, and that is, I think the campaign was labeled very appropriately. It's hear her. Like, listen to them.
Yeah.
Listen to the women. Listen to what they're saying. And you're right. It's not, I want somebody to listen to me, hear me, right? But it's also the support system, like you're alluding to. I think that's key because we do need to be listening to these women and help them with this adjustment and this struggle, whether it be with a postpartum anxiety and blues or preeclampsia or whatever it may be. But we need to listen and act. Right.
Agreed.
So I think that that's important what you're talking about.
Exactly. And so when it comes to all that, the healing part, what are some tips for moms first? What are some tips that you like to give to our viewers of how to recover postpartum?
Right. So I think a lot of that is related to the mode of delivery. So the vaginal delivery patients, the natural childbirth, like, I think that's an old wives' tale about, oh, you have to rest and stay in bed. And I disagree 100%. The more active we are, the quicker we're going to heal.
Okay.
Laying in a bed all the time increases our risk of blood clots in the legs, blood clots in the lungs. I mean, it can be really bad. So getting up and moving. The fortunate thing is nowadays in the medical community, it's kind of, I don't want to say frowned upon to have an episiotomy, which is a surgical incision to help give the baby more room on the perineum or for childbirth naturally.
Okay.
But we try not to use episiotomies these days. Like that's kind of something that's, if we need it because we're going to do maybe an instrumental delivery, then we need more room. We have to do what we need to do to get the baby delivered appropriately and safely.
Yeah,
but those days are pretty much gone. Maybe there's a little tear here and there. So getting up and moving, despite those episiotomies or those lacerations, are very important. And that will help. Now, our C-section moms struggle a little bit more, but they still need to be getting up out of bed so they don't have a complication from laying in bed too long after a C-section. And even though it hurts so bad, just take the pain medicine and get up and move. That's super important.
Okay.
I am an advocate of breastfeeding. I think that breastfeeding has many benefits. We always talk about the benefits towards our babies to help protect them from infections because we pass our antibodies to our little ones and our nutrients and things that we make, the sugars and the electrolytes, all that is really wonderful for our babies. And I do believe that. But formulas these days are pretty darn great, right? But when we breastfeed our babies, it helps us get our weight down quicker, right? So women gain weight in pregnancy, so breastfeeding helps with that, get more active. But it also releases a chemical in the brain that makes us feel good and euphoric.
Yeah.
So not only will it help us lose our weight, feed our babies, it's a good bonding thing to do, but it also helps us have a sense of euphoria. Of course, there's adjustments at the beginning when we're learning to breastfeed. And breastfeeding isn't for everybody, and that doesn't mean the mommy is a failure. That just means it's not for her, and that's okay. There's other ways to recover, but I believe in breastfeeding is very good. Being active, taking your prenatal vitamins. We do see women who develop anemia throughout their pregnancy. Maybe they had anemia coming into the pregnancy.
And that's like low iron.
Low iron levels, yes, ma'am. Or they develop what we call a physiologic anemia in the pregnancy. So their provider, their doctor, their nurse practitioner, whoever, may encourage them to continue postpartum prenatal vitamins to help replenish those iron stores and just stay healthy. I think everybody should be on a vitamin anyway. That's my nuance. But because you don't know when the next pregnancy is going to happen, right?
True.
You want to be on folic acid to prevent spine and cerebral spine defects or spina bifida is what I was alluding to. But those are things that can help. And also keeping that line of communication with your support service, right? So like whether that be your mom or your husband or your boyfriend or your sister, or communicating and talking about how people are feeling after delivery is important to a healthy recovery. So, hydrating, drinking lots of water, having a healthy diet. Everybody knows these normal things, but I think about getting up, getting outside, fresh air, talking to people, breastfeeding, exercising if you're able, if you haven't had a C-section right away. Those are things that and then of course, keep your postpartum visits. So this is something that I think is super important. I don't think women realize that if you've had a blood pressure problem while maybe you're being induced for preeclampsia, or maybe you developed preeclampsia while you're in labor, or maybe you wind up needing a C-section because of
While you're in labor?
Yes, blood pressures can go up during the labor process too. Those patients should be seen by their provider within no more than 3 days.
Oh, wow.
Yeah, so people are getting discharged from the hospital and, go see your doctor in 2 to 3 weeks. That's not considered standard of care. Oh, wow. So they need a blood pressure check to look for those postpartum preeclampsia issues right away. So if they're seeing their provider within 2 or 3 days, even if it's a simple nurse visit for a blood pressure check, that's very important. So when people are getting discharged from the hospital, they'll say, I delivered vaginally. Yeah, you can see your doctor in 4 to 6 weeks. That's okay if you've had an uneventful, uncomplicated, beautiful birth. But if you were being induced for a reason, if you have gestational diabetes, gestational hypertension, preeclampsia, pre-gestational diabetes, chronic hypertension, all these issues should be followed up on a quicker basis and ask the question. Like, I just was induced for preeclampsia. Like, when should I get my blood pressure check? The answer from those providers should be within 2 to 3 days.
2 to 3 days.
Yeah.
Okay.
Yeah,
wow.
That's something people don't realize.
I was about to say, I never heard of that.
Yeah,
and then my visit was for C-section, like 6 weeks? Just like the normal 6 weeks afterwards, see everything was okay. And that was the quickest. The quickest visit.
Well, unfortunate, and everybody has their own practice style, right? So I can't allude or insinuate how people should run their practices or what they do in their offices. Maybe they're too busy to see people. But my standard practice was to see patients from their C-section within a week or two, just so I can check their wound, make sure they're healing, not getting infection, check for the blues. If they were nursing, how's the nursing? If they chose not to nurse, or maybe they couldn't nurse, what's their engorgement like? So it was a little touch point within a week or two. How are you? And then now, unfortunately, with the business of medicine, sometimes that was not a reimbursable visit, but I didn't really care. But the 6-week postpartum is the official. So, and everybody has their own style. So I defer to my colleagues out there, but that's how I would do, just to have a little touch point. How are you?
And that's good to know, just like for our viewers, like 2 to 3 days, if there was some kind of complication, even if it's just like high blood pressure, if anything, like they should take the initiatives to themselves to go see the provider. And also, this is a message to their support systems, like push for that. We want a healthy recovery, and a healthy recovery ends up being a healthy family still.
That's right.
All around circle. And so we just want that, and it literally takes a village. And whether it's just one person you have, or just making sure someone is following up with making sure that everything went well, that's important to have.
That's right.
So any tips for dads and how they can help with postpartum recovery?
I think our dads get forgotten, right?
Yeah.
And they go through that too. It's a whole new change in their lives. Being supportive, I think that's key. I think when it comes to the fatigue of having a newborn, it's the high five, it's your turn, right? So when mommy's exhausted and maybe breastfeeding or bottle feeding, take turns. Or maybe the mom's going to breastfeed and I'm really exhausted, I'm going to go back to sleep, and pass the baby off to the dad to do the burping and the diaper change and things. Incorporating the support system around is very important to childcare, especially the newborn that's up every 2 hours and exhausting you. But also realizing that the partner, he or she is going through that change in life too, and listening to them and their needs. Because you're right, everybody kind of focuses on the little one and making sure that baby's getting, and it's new, right? Like a whole new human in our family. But we also have to look at our partners and meet their needs as well. So I think it's a mutual listening to each other, and getting daddy involved in all the baby care as best as we can, especially in moms where, first-time moms especially are like, oh, well, you don't know what you're doing, and I'm just going to take care of the baby. But the dads need to learn because and show them, because that will help the mom in her recovery process. and to also lift that burden that it's not just all on me, right? I have to do all the feeding and the diaper changing and the washing and, oh my gosh, the house and the kitchen and the food and the meals. And
Never
it can be,
ending.
yes.
Yeah.
But incorporating dad as part of that support team, because it took two to make that baby, and it's going to take it two to care for that baby, whether that support person or the daddy is there, or maybe the mom-in-law or the mother of the patient or the sister or whoever their support network. Incorporating them, and that not only helps them to be part of the care, especially dad, but it also gives mom the break that she might need to take the power nap. Yeah, and that's one other thing you had asked about, what is some of the tips of recovering? And I think that especially first-time mommies, they're, well, my baby's taking a nap. This is the time to do laundry.
Yeah.
Or my baby's taking a nap. This is the time to prepare food, right? And I would disagree with that. I would say that because of the exhaustion, when your baby takes a nap, take a little power nap too. It's okay to let your kitchen go uncleaned for a couple days, or it's okay to wear that T-shirt twice or whatever, just do more self-care and get some rest when you need, because when women are exhausted from a newborn, their coping skills and their coping mechanisms are more challenged, and as a result, they may, bite back in their response rather than feeling rested and like, okay, I don't think he understands what I'm going through. Yeah. I'm not going to yell. I'm just going to, answer this way. If you're rested and taking naps, when baby takes naps, you're more, you're a happier person to be around. Maybe that's the better way to say it. But taking little power naps, that's something too. And the dad too. I mean, if he's exhausted because y'all are both up 24/7, that's not helping anybody. So let dad rest when he can rest. Let mom rest when he's helping. Those are little coping skills.
I like how you said self-care. And that's one thing I'm definitely going to do whenever that time comes, is see it as more self-care rather than like abandonment of like kitchen or clothes or something. Like it's self-care for just myself and for me to be a better me. So I know we mentioned tips for moms and tips for dads. What about like tips for like the village, whoever they or however that may be, especially with families that have more than one kid? Yes. 2 or 3, like what would be your advice for them?
Yeah, so I think the children of the family, the newborn coming home, sometimes they get forgotten. Their world is getting rocked too, right? Because this is a whole new human in my house, and it was all about me, And so incorporating the siblings into care, I think, is important. Whether that be, honey, can you go grab the diaper and some wipes for me and bring it? Or, honey, it depends on the age of the kid, right? Honey, can you hold the baby for a few minutes? I'm going to go run to the restroom, Incorporate and letting those siblings know you are important and I value your service to me while I'm caring for my little one. Yeah. And that empowers them, and that gives them some self-confidence, right? There's going to be some rivalry in the beginning because they're adjusting as well, but incorporating that little village, that's important. And I think also for the mom and the dad of the newborn to speak out to their village, their support system, and ask for help. Yeah. I think some people like, well, that's her family and she has a newborn. I don't like mother-in-laws or moms. I'm going to let her find her way. I didn't have anybody to help me. She's got to learn how. I don't think that's okay. I think that the women need to ask, and it's okay to ask. It's okay to be vulnerable, to ask for help, and to let people know. Some people, especially with the first mom, they don't know how they can help. Maybe it is to go clean the kitchen or do a load of laundry or prepare a meal. But voicing what your needs are, and that's okay to ask for help, and it's normal. And letting the support team and the village know what your needs are together to help raise this newborn. I think that's my best piece of advice, because many people on the outside won't know what they need to do to step in. Right? Exactly. So communication and saying, and don't be proud, like don't be prideful and say, I could do this on my own. I am woman, hear me roar. Yeah. It's okay. We've all been through it. Moms who've had children, or maybe if you haven't had children, but you see what your sister has been through, or your brother and his wife has been through, to say, oh, they really struggled with meals. Maybe, do y'all need help with meals? Just ask, how can I help you?
Yeah.
And sometimes so it's a mutual communication.
Wrapping up our postpartum talk, what are the must-knows when it comes to postpartum depression and just recovering postpartum?
Yeah, that's loaded. So we kind of alluded to some of the warning signs.
Yeah.
Listen to your body.
Okay.
For the support system to listen to the newly delivered mom. If you're feeling hopeless, helpless, and weary, ask for help. And those Hear Her campaign warning signs, you can find those on the Driscoll Health Plan website, and you can just go online, Hear Her campaign. Headaches that don't go away, pain that doesn't go away, unrelenting, bleeding that doesn't stop, fever that doesn't go away. These are all shortness of breath, chest pain, excessive swelling more than you were when you were pregnant, that stays. These are all warning signs, and you need to go see your provider right away or call them to ask for help.
Thank you. That was very educational. So I'm really excited to finally talk about my story.
Yeah.
About my first birthing experience
with
an expert. And I feel like we already kind of we broke down that wall, we developed that little friendship. So first pregnancy, we were in Houston, March 2020, COVID.
Yes.
And so
scary time.
While we had this perfect plan in place, like this is what's going to happen, in January, we're thinking like this is everything we're going to do. Everything shifted and we didn't know what to think come delivery time.
Right.
So I just missed the cusp of where patients had to wear masks during delivery.
Okay.
So it was only still just one person, and but no mask. And so we were scared. We didn't know what was going on. We didn't know if my doctor was going to be there.
Yeah.
Because she was in quarantine herself.
Yes.
And so going through all that, my birthing plan kind of just like went out of my head.
Yes.
And let me track back. So I felt my water break just a little bit, if that makes sense.
Yes.
Like I felt like just like, oh, well, I never had this feeling before. I think I'm going to call the doctor. So I did talk to the other doctor in the practice, and she said like, okay, well, check for these signs or just give me a minute. Let me call the hospital and see if there's even room for you over there.
Yeah.
So I said, okay. And then I got a call, said, just head to the hospital. They're going to check everything there.
Yes.
Okay. So we did. They're like, yes, your water did break. I'm like, okay, great. And so we're there. And then I felt, like now, like looking back, I felt that everything was just immediately pushed on.
Yeah.
I didn't get to experience the bouncing ball or walking around to try to further along my dilation. I was stuck at a 5 for 24 hours. And I was told to prevent further infection that I would need a C-section. And before all that, it was like the Pitocin and everything like that.
Right.
I was like, dang, now that I look back, I didn't get to try all the other maneuvers to try to further dilation. So that was one thing that I noticed. And then the C-section part.
Yeah.
My mom had a C-section of me. And she always told me like, oh no, it was okay. Like it was fine. Afterwards, I'm like, mother, you lied. Why did you not ever tell me? Like, I didn't want to ever tell you the details of it in case you ever had to do it.
Right.
I just remember like going in and they were checking like, okay, well, do you feel this still? Do you feel that still? I'm like, yeah, I still kind of feel it. Like, how much longer? And like, okay, well, we'll just wait a little bit much longer. And they checked again, like, do you still feel that? Like, yes, I do. Am I supposed to feel this? Like, she's like, yeah, you're supposed to be able to feel something, but not like the actual cutting.
Right.
I don't know if I'm just dramatic, but I felt like the cutting part, and I felt just very uncomfortable where I was just like, not like, it was just very, I don't know if it was supposed to be like that.
Right.
She came out, she ended up being 9/11.
Oh.
I had no idea.
That's why you didn't dilate.
Okay, now it makes sense.
Yes.
My doctor predicted somehow like, okay, yeah, you're right on track. She's looking about 7 pounds, like perfect. I'm like, okay, great. So when they said 9/11, I said, ma'am, what?
Yeah, she didn't fit you. That's what happened.
That makes sense.
Yeah.
Okay. And she was also, we made it to 41 weeks.
Yeah.
And almost 42.
Yeah.
So I was like, oh, you were just real comfortable in there. And like, your foot slipped or something slipped.
Right.
For my water to break. So I from not knowing anything really and going in and like C-section and everything, I didn't know much. Going in, I felt like everything was just like, okay, you need to do this, you need to do that, rather than, do you want to do this? Do you want to do that? I was like heavily persuaded just because I didn't know everything.
Right.
So like, what do you think about like just the patients that go in and like, they had a birthing plan, but everything's out the window. You can kind of tell like it's their first time mom.
Right.
Not really knowing what to expect going into labor and delivery.
Yeah. So the first thing that I want to say is I'm sorry you had that experience. Unfortunately, that set a precedent going into this pregnancy, but know that things can be different, going into the next pregnancy. The pandemic was a scary time, and, I practiced during that time. So, there was a lot of unknowns for everybody. But being with a unfamiliar doctor and, your doctor was in quarantine, all these things, how scary that you must have felt.
Yeah.
There are a lot of different reasons why people get C-sections. And I think one thing that I can say about us as specialists of women's health is sometimes we're not the best at communicating what's going on. Sometimes we're communicating, but the patient and their family members aren't receiving the message.
Yeah.
So the picture and the water can be very muddy. But it's unfortunate that happened to you. But I can actually say, just by hearing a snippet, and thank you for sharing, that your baby was too big to fit you. That's really what happened. And so there's a lot of different reasons to have a C-section.
Yeah.
And that's one of the most common in our area because we deal with gestational diabetes. Sometimes it's not well controlled and the babies can grow too big to fit.
See, and I took that test.
Yeah.
Or like, I did all the measures and nothing ever came up of for
The
me to even be
diabetes.
worried about,
Right.
or like my numbers were normal.
Yeah.
And so for the fact that when they said that, and then afterwards I did get comments from people like, oh, like, did you have gestational diabetes?
Yeah.
I'm like, no.
Well, so this is another point, and that it's misinformation, I guess I could say. We screen early. We can screen at the beginning of pregnancy, like, going into this pregnancy, I would assume you're going to have a diabetes test early just because of the size of your last baby. But the routine time to screen is 26 to 28 weeks.
Okay.
But that doesn't mean you can't develop gestational diabetes after that.
Oh, wow.
Right?
Yeah.
So every time you go to your doctor, prenatal care is important, and the nurses are checking the urine for many things, protein for preeclampsia, infection signs, and also for sugar, because women can develop diabetes later after that routine screen time. And so if I'm seeing a patient that has, when I was in private practice, a lot of sugar in their urine every time they came, then I'm like, well, wait a minute, maybe she's developing diabetes later in the pregnancy and she passed her screen test, but now she has it at 32 weeks. You see what I mean?
Yeah.
So that might have been your scenario as well. And the importance of prenatal visits.
Yeah.
There's reasons why we're doing things that we do to look for problems before they occur, right? So, and then to allude to your C-section, when we do C-sections, like we can't make them 100% comfortable. So you should feel pull and tug, but you should never feel pain.
Okay.
So that, there's a test, like, do you feel this? Do you feel, where do you feel?
Yeah.
And that was the anesthesia person, the expert, trying to assess the level of your comfort.
Okay.
And maybe your level wasn't to the right level. I don't know, but it sounds to me, if it was that uncomfortable, that maybe it wasn't dosed high enough or whatever the scenario.
So what, now that I'm pregnant the second time, what should I like if I need a C-section again, what should I feel? What should it feel like?
You should feel the pressure of the touch, but you should not feel the pain of it.
The pain of it.
So you'll feel us when we do our surgeries. You'll feel the pull and the tug and the push and the, like when we're pushing the baby out and all those things. But you shouldn't have pain with it.
Okay.
So
just a lot of like uncomfortable feelings, or
it's hard to tell. Like I mean, because it's not comfortable.
Yeah.
And you're laying in a bed and people are like talking around and you're like, okay, this is not. But you're feeling a pull and a tug. So I don't know if you were feeling pain or if you were feeling the same nudges and tugs and pulls that are normal in a C-section.
Yeah.
Because part of the point of being awake is we want you to meet your baby.
Yeah.
We want you to have that first kiss and the bond and the picture and we want that experience for you and your loved one. But we don't want you to feel the pain of it, right? So putting people to sleep for a C-section can be very dangerous for a mom. We try not to do it.
Yeah.
And so for many reasons. And so I'm not sure if your epidural or your spinal anesthesia wasn't dosed all the way, or maybe you were feeling the normal things. It's hard to say.
Yeah.
But you had a lot of factors playing into your delivery experience. And so, I think that having a C-section for the first time can be very, it wasn't your birth plan.
Yeah.
And, we as doctors, I used to have my patients bring me their birth plan and so that we could read through it.
Okay.
Maybe at about the 32 week mark. So I know what their expectations, because sometimes people come with unrealistic expectations of their birth plan because they've never had a baby before, or maybe they had an experience this way and this is not the standard of care now. So knowing what the birth plan, and I would sign off on it, and the nurses knew in the labor unit, Dr. Doucet's signature is there, so they've reviewed her birth plan.
Yeah.
So you should, for all of you out there having a birth plan, you should take it to your doctor first and review it so you know what is normal and what is not. So that's number one. But we kind of have a joke in the doctor, oh, she's got a birth plan. Oh, that's kind of a bummer. That's like, maybe it's not going to go that way because you have that expectation.
Yeah.
And for you, for example, it didn't go the way your birth plan said. But it doesn't mean we can't follow those wants and desires and aromatherapy and music and lights down and all those wonderful things that we try to do.
So would you say, now that you just know a bit of my history, how possible, or would you say a VBAC is possible?
Yeah, so VBAC is something that we use. It means vaginal birth after cesarean. VBAC, a lot of us call it TOLAC, trial of labor after cesarean. TOLAC is a common terminology. And I think it's unique to each individual. You've got the provider has to tease out the history as to the why. Why did the C-section happen? So I'm an advocate of vaginal birth after cesarean, depending on the scenario.
Yeah.
For example, I know that a 9-pound, 11-ounce baby can't fit you, right? So you would be a good person to be monitoring the sugars, especially towards the end of the pregnancy.
Okay.
And maybe getting an ultrasound at the end to get an estimation. Ultrasound is not exact, but it gives us a ballpark. So if your baby is appropriate size, then maybe you should try a trial of labor. You don't have a pelvis that's what we call proven. We don't know if you can do it.
Yeah.
Especially with your mom having a C-section and then you needed a C-section. Maybe your pelvis isn't the shape that allows vaginal birth.
Wow.
But you also had a big baby, right? So there's many factors in your scenario. But many women get cesarean sections because their baby had distress. And that wasn't related to the fact that the baby may not have fit the mom, but the baby was having a scenario that wasn't tolerating the labor that warranted the C-section, right? So there's different circumstances. Maybe there was an infection and the uterus stopped contracting appropriately, so there wasn't enough power behind the contractions to push a baby out. So those women there's many different reasons why, and maybe we can do that in a future podcast, like the reasons why women get a C-section. But I think it's important for the provider to tease all that history out, have a very blatant discussion, because the recovery is easier after vaginal delivery than a C-section. C-section can have its risks as well. Vaginal delivery can have its risks. But, the goal would be to get mom up and about and enjoying her family and her newborn rather than recovering from a surgery, which can be very daunting too. So, but I'm an advocate. Many of my colleagues are. Not all hospitals are equipped with the ability to have vaginal birth after cesarean. Maybe they don't have anesthesia in the hospital 24/7. Maybe they don't have an operating room that can be opened with the snap of a finger in case an emergency happens during the trial of labor after cesarean. So and sometimes providers I don't want to take that risk. I don't want to run that risk for my patient having a vaginal delivery because it is a higher risk state. But many
a
people,
lot of factors go into it.
It's very complex.
Yeah.
So put a pin in it for another podcast.
Yes,
maybe we should
for
talk
sure.
about that.
More to come.
More to come.
I'm excited. Well, thank you for allowing me to share that story with you.
Yeah, for sure. And thank you for
everyone
sharing.
knows my story.
Well, it's out there now,
yes.
girl.
But now I know what to really look forward to, and just also how to approach my prenatal visits.
Yes.
And what to have in mind and what I need to ask my doctor, and just now I know more.
Yes, for sure.
So
good.
I really do feel prepared. And
empowered with information.
Empowered with
That's
information.
right, for sure.
Exactly. So we have one more thing. So
Okay.
ask the OBGYN.
Okay.
So we went on our social medias.
Okay.
And we put a question out there about anything anyone wants to ask.
Do we need a drum roll?
Oh, yes. Let's insert drum roll. So, first question. Can I eat before going to the hospital for delivery?
That is a loaded question. When you get to the hospital, if you're truly in labor, usually we don't let you eat. We do let you have liquids and ice chips, but many women in labor will get very nauseous and they will vomit. And so if there's food in the tummy, that can increase the risk of inhaling that food into the lungs, which can be very dangerous to the mom. So we usually don't let you eat at the hospital. If you eat on their way to the hospital, there's nothing we can do about it. But if you're truly in labor, there may be some risks associated with that. But can you eat in labor? The answer would be no. Eating on the way there is very common. So, we'll just have to deal with that if it happens.
I love that answer because we're always just told don't eat or we can't, and we're never knowing a why.
Yes.
So now I know that
there's a reason to everything that we do. There's always science behind it. It's not because we're trying to be mean.
I love it. Okay, second question. How many times a year should I see my OBGYN if I'm not pregnant?
Oh, that's a great question. So at the bare minimum, one. Like everybody needs their annual exam. It may or may not require a pelvic exam depending on the age of how old you are. But I think that women should meet their OBGYNs yearly at the bare minimum, if anything, to make that relationship so that if you do have a problem, irregular bleeding or vaginal discharge or belly pain or breast tenderness or whatever, that you have that relationship with your OBGYN so that you feel comfortable calling for that appointment and getting that problem cared for. But a bare minimum, one.
Perfect. Last question. Do I have to get on birth control after pregnancy?
Yeah, no. So that's also loaded, and that has to do with your personal beliefs and values in your family. We do like to space birthings or deliveries just because if you get pregnant right away after you've recently delivered, there can be some nuances in terms of complications in the subsequent pregnancy, most commonly preterm delivery of the next baby. So spacing pregnancies is important. It doesn't necessarily mean that you need to be on birth control, and that's a very individualized decision between the patient and her provider.
Perfect. I love that answer. So that wraps up this episode.
Yeah, good.
Thank you so much.
It was fun. I had a good time.
It was really fun. And I can't wait to dig more into women's health and maternal health. There's so many more topics that we can go into. So if our viewers, if you have any suggestions on what topics you want Dr. Doucet to discuss next time, leave them in the comments. Send us a message, anything, because there's so many ways that we can go with this. And also follow Dr. Doucet's Med Spa.
Oh, yeah. Doucet Med Spa is who we are. And we're on Instagram and Facebook and TikTok and all those things.
Perfect.
So it's Doucet Med Spa.
Awesome. And we'll leave the link down here. And then also follow us for more episodes to come.
Yeah.
Thanks, everyone.
Thanks for spending time with us today.
Thank
It's
you.
fun.